According to a recent survey, approximately 63% of board-certified behavior analysts reportedly never or almost never used FA methods to identify problem behavior. Now that number may seem alarming, but given, the myths and the obstacles surrounding an FA, it also makes sense. So let's talk about it on this installment of Incompetency Assessment. Could this actually be a series? I don't know. This might just be a one-off. Hey guys, my name is Matthew Mendoza. Currently I'm an RBT and have been working in the field for 3 years as of recording this footage. The majority of my field experience consists of working in a private clinic setting with in-home sessions often and some school and community-based sessions. I don't particularly have any plans as to where I would like to practice more, but I would like to learn some more about staff development, specifically RBTs working in a clinic setting. Because I've spent 3 years in the field and I don't have much experience outside of this setting, it feels like I haven't had much experience. My lack of setting experience is probably why I'm going to call this video Incompetency Assessment, because I don't feel very competent due to my perceived lack of experience. But let's assess what I don't know and we can learn together. I'm getting my white Air Forces dirty in the name of content. Previously, I had been part of a collection of QABF data regarding several functional behavior assessments being conducted by FBAs, and I collected and aggregated data from several staff members who work with the same client to hopefully determine, anecdotally, the functions of the behavior of interest. Now, currently, as behaviors with the clients on my caseload are often well documented prior to intake, and any instances of behaviors are often easy to determine via ABC data, dedicated behavioral assessments are not as commonplace where I work. In both cases of conducting either an FA or FBA, the main goal behind it is to simply understand what are the functions of a behavior of interest. Both accomplish the same thing with the same information. What are the setting events? What are the behaviors that occur in said settings? And what happens afterwards? And how should we know when to conduct one? Typically, if some problem behavior pops up more frequently and we have no idea where it came from or how it happens, then some form of a functional behavior assessment should be conducted. Now, both an FBA and FA use data that is gathered through indirect measures like interviews or forms like the FAST or QABF. The components of an FBA or an FA are usually gathered from direct observation and then, optionally, problem behavior pathways and competing behavior pathways. So through all that information, then one can use that to form a function of behavior hypothesis. And that hypothesis will form the basis of the intervention going forward. However, the key difference between an FBA and an FA lies in what happens after the information is gathered and the hypothesis is created. Because an FA is almost the exact same thing, but an FA actually tests that hypothesis. It is bright out here. I don't have my sunglasses. Now suppose you have a client who engages in stereotypy. The proposed hypothesis is that the function is sensory or automatic, but it's believed to have some form of an escape component. An FBA would stop there and create a plan based on that. An FA, however, would actually put that to the test. So since the hypothesis is that scripting is automatically maintained, then we would test that condition. The FA would tell us if we were correct. So in this case, the control condition would be that the client would have access to sensory input toys. The test condition would be that the client would have no access to sensory input until stereotypy is emitted. And if the hypothesis coined in the FBA is correct, stereotypy should stop when sensory toys are provided. If the hypothesis is incorrect, then the new test condition should be the other hypothesized function, which was escape. And because an FA relies on testing the hypothesis of the conditions that cause problem behavior, it almost always results in the sharp increase of problem behavior prior to implementing the intervention. So that means if you're testing whether or not a problem behavior will occur, it would probably be best not to try an FA at a client's home. You'd want to try it in a treatment room, where you can keep the environment stable and, if need be, watching through a window to see if everything is okay. Due to the nature of an FA being that ethical considerations of purposefully allowing problem behavior to be emitted, and the validity of research showing that functions are less isolated and more synthesized, i.e. multiply maintained behaviors, my current workplace actually prefers to use IISCAs, also known as IISCAs, which stands for an Interview-Informed Synthesized Contingency Analysis. This is a lengthy acronym to describe all of the steps to creating the FBA and FA. However, the key distinction here is that instead of presenting each condition by itself, we will combine them. That's why they're called synthesized contingencies. and they are designed to include the following. The response topographies that will and will not produce reinforcement in the test sessions. For example, the client gets reinforcement from something, but the question being asked here is, what does that response that reinforces the client look like? The specific contingencies that will and will not be addressed, like the relationships between the presence of a behavior and the consequences of that behavior, or vice versa. Lack of behavior versus the consequences of not admitting that behavior. The extent to which the contingencies will be assessed simultaneously, like which relationships between behaviors and consequences are going to be addressed during the FA at that same time. The specific conditions that will be allowed to evoke problem behavior, like which antecedents will be contrived based on the information gathered from the interview. And the specific materials and interactions used during reinforcement. That is self-explanatory.
IISCAs are more preferred in our place of work because real social environments need to be closely replicated, and the situation most often calls for multiple factors, and therefore the IISCA should include those factors presented at the same time. One contingency may not evoke said behavior, but a combination of several contingencies may evoke that behavior. And then one contingency may not reduce said behavior, but a combination of several contingencies may reduce that behavior. And this mindset has yielded more results across FAs and treatments everywhere.
Remember how in the beginning I talked about that statistic that said 63% of board-certified behavior analysts had not taken the time to run an FA? Here are several obstacles that were outlined by Dr. Greg Hanley in an article written in 2012. The first one of the most important ones, is that he said that FAs take too much time. To dispel that obstacle, that FAs take too much time, they may actually take as little as 30 minutes to complete. FAs are also too complex. Regarding complexity, actually, FAs are less complex, and studies have shown that undergraduates could accurately implement FA conditions after just 2 hours of training. Basically, if you're capable of changing some aspect of the environment and determining the effects of that single change on a direct measurement or problem behavior, then you can probably conduct a functional analysis. That's a direct quote from Hanley. And FAs are too risky. Regarding the obstacle that FAs are too risky, that is true. The question being asked during an FA should be that, will the child be at greater risk in the analysis than that which they normally experience during the day? Or will their problem behavior be more dangerous or intense in or outside of the analysis? In general though, the problem is that higher rates and intensities of the problem behavior are almost guaranteed if you do not provide the proven reinforcer as gathered through those indirect measures for each and every problem behavior in your analysis. And they are quite a hard sell to constituents. One way of explaining FAs to stakeholder clients is via explaining it like an allergy test. Kind of like this. There are controlled pokes of saline, and then there are various allergens to see which one produces the worst effect on someone's skin. In essence, that is what an FA is. And like allergy tests, FAs are informed by the pre-interview. Like in an allergy test, you would be interviewed as to what your symptoms are. An FA, you'd also be informed as to what the behaviors look like. The article that described the survey I talked about earlier in the intro cited the following factors as to why functional analyses are less preferred compared to functional behavior assessments. 1 is lack of time. 2 is limited physical resources. And 3, most of the practitioner's primary scope of practice is maladaptive behavior reduction, and therefore the risk of injury in certain contexts makes it inappropriate for practitioners to conduct an assessment that will allow the behavior to occur. And this research supports the ethics surrounding the problem with FAs and why IISCAs are better. IISCAs also address the following concern posed by the researchers in the article. They emphasize teaching brief functional analyses that can be used in naturalistic settings, and IISCAs do this by implementing synthesized contingencies and closely replicate the social environment in order to naturally replicate the setting. It is easier to synthesize contingencies than it is to isolate. And then in a more recent review of literature, they showed that synthesizing contingencies during an FA is proven to be effective. The results from those studies done in this review all showed large, generalizable, and socially valid outcomes. The researchers also go on to recommend that practitioners consider using the IISCA because it has been found to inform function-based treatment with as little as 1 clinical visit. So in my coursework, I have only had experience conducting an FBA, and I have been a part of conducting so many of those descriptive assessments that I know how to do one without being formally taught. However, given what I know about IISCAs, what I've just learned actually, it would be more interesting for me to try one out myself as I've never implemented one before, and I would like to start. My question is more of a general one though. Have any of your BCBA and BCBA supervisors had experience with FAs and IISCAs? And if so, is their mindset around conducting FAs similar to my supervisors? Learning about FBAs and FAs has actually made me see more of the practical side of applying it in my own clinical setting. And therefore, I'm actually really happy that I learned more about it. And I hope you are too. Thank you for learning with me on this episode of Incompetency Assessment.
To the town of our free rode a stranger one fine day. Hardly spoke to folks around him, didn't have too much to say. No one dared to ask his business, no one dared to make a slip. The stranger there among them had a big iron on his hip, big iron on his hip.